And we did our first sortie between Bishanpur to Sangang. And that island has 3,000 to 4,000 people. And that is not connected by a road or anything. And we delivered vaccines there and people got vaccine and they were very happy.
Imagine a world where life-saving medicines, blood supplies, and even organs for transplant can be delivered in mere minutes, bypassing traffic jams, soaring through the sky like futuristic couriers. Sounds incredible, right? Well, it's not just a dream. It's happening right now with drone technology, and ICMR is leading the way. Welcome to another episode of ICMR Radio, Unpacking Health Research in India. I'm Sanjana, and today we're taking to the skies, quite literally. With us today to shed light on this high-flying innovation is Dr. Sumit Aggarwal, Scientist D at ICMR HQ, who is at the forefront of this technological leap. So whether you're a tech enthusiast, a healthcare professional, or just someone curious about the future, this episode is for you. Dr. Aggarwal, hello. It's an absolute pleasure to have you here today. Before we were shooting this podcast, we were talking about your leap into the world of drones. And I think you told me that you started out being a medical doctor in 2020 and now you're a drone expert.
Yes, so actually I'm a medical doctor, MBBS and MD, and I did my MD in public health. This happens actually, drone was definitely not known to me at that time. India as well as the globally, we were facing the COVID pandemic. And I was doing a work of epidemiologist, operational research in public health at ICMR headquarters. And one day when ICMR was leading a vaccine in that days. So ICMR, our DG that time, Dr. Gulram Bhargav said, okay, now soon we will have vaccine. So we have to deliver these vaccines to the last mile. Last mile as like everyone can get benefit of it. So suddenly he got the idea, okay, why should we do not deliver the vaccine by drones? And he said, okay, Sumit, you do it. So I was, being a medical doctor, was just aware, shadi wala drone jo hota hai. So I thought, okay, sir, but we are talking of something which is not with us, vaccine, and delivering it by a thing which is not
Also
there,
not
even
with us,
drone. So sir said, okay, I don't know, like people are developing vaccine, you have to find out the way, how we will do it that time. And we contacted many DRDOs and ISROs, those who were there. And we tried to find out how we can get a drone, because that time drone rules in India was not there. So, and there was no drone policy related to vaccines can be delivered. So it was entirely a new thing for system, even the India also ICMR and even for me. So we find out like IIT Kanpur has airstrip.
Okay.
And they do some work in drone technology. So we did some initial trial during the COVID time. And the peak of COVID, second wave was in April and May, and the country was in lockdown.
Yes.
So we went all to the Kanpur by car, and then we reached there. We worked on the drone. We did some initial trial because you cannot go directly into the field.
Correct.
Without your trials or feasibility studies kind of thing. And this thing was not happened before in India, in South Asia. So we were not having many literature on it. So we have to learn everything from the starting. So I also started learning about the types of drone, what is BVLOS, what is LOS. So there are so many technical things on which there are multi-rotor drones, single rotor drones. So we started working on that. Then we got dummy vaccine from the Serum Institute of India. And then we started working with these dummy vaccines vials, and we developed a drone. We did feasibility trial there for 15 days. And after that, we found, okay, vaccines can be transported through the drone, and it's going to be happen soon. So we came back to the Delhi, and we presented a small brief report to Ministry of Health and ICMR. All were happy. We were also happy. Okay, our job is done. So this is how we started the drone part. So how it's come. Then we presented things to the ministry and the ICMR. Then DG said, okay, now it's done. Well done. We said, okay, happy. So said, no, this is not, and this is just the starting. So he said, okay, so where you want to deliver the vaccines, where you want to have real trials, ground level trials. As a human nature, we thought we should pick up the easy things.
Correct.
So we said, okay, sir, we will do it in Manipur, not in Manipur, maybe in Rajasthan, Uttar Pradesh, MP, because these are flatlands, we can easily fly the drone and we can deliver the vaccine. Sir said, नहीं, ऐसे नहीं होगा. If you can deliver vaccines, the most difficult, toughest part of India, then you can deliver it anywhere. So, okay, so you go somewhere in Northeast. So we said, sir, where? And sir, somehow he got the two name. Okay, you have to go to Manipur and Nagaland. Although we were very much aware of Indian geography, but exact point was even I was not aware, okay, here is Nagaland and here is Manipur. So we started finding out, then we got to know like Nagaland is totally hilly terrain, is very difficult, and Manipur again is a difficult terrain. So sir said, okay, I don't know, you find out the way again and then ask for exemptions to the government and everybody, and then this thing started.
Now that you've done this and it's kind of rolled out and it's been 4 years since, I'm keen to know how the ICMR is actually utilizing this drone technology, and specifically what is the iDrone project, if you could tell us a little, and more importantly, like you rightly mentioned, this epitomizes last mile delivery, but how is it revolutionizing healthcare delivery in other ways?
I will tell you in the continuation of that story only.
Excellent, please.
So even we were not aware whatever we are doing, it's going to be so big. We asked Government of India and Ministry of Civil Aviation to provide us some exemptions. They gave us some resolution and office order. They gave some exemptions. Okay, you can fly a drone in Manipur and Nagaland. And Ministry of Home Affairs, state government, everyone is in alignment, because ICMR till then was able to develop vaccine, and ICMR and India started the rolling down of vaccine. Practically, we were facing difficulties in delivering vaccines to the far-flung areas, especially in Manipur and Nagaland. So we started with Manipur and we gave a acronym. Till now, there was no acronym.
Okay.
So we gave a acronym, ICMR's Drone Response and Outreach for Northeast.
Okay.
So it's stand for
all right.
iDrone.
Yes.
So its drone is not just a drone, it is acronym of Drone Response and Outreach for Northeast. So we started and thinking just we should deliver some vaccines in Northeast. So we started it, and Honorable Health Minister did inauguration. We faced so many difficulties because there is army, paramilitary forces, roads are difficult, and everything was happening during the COVID time. So many less human resource and manpower was available there. So we did everything whatever was needed. We got all the support from state government, central government, and ICMR definitely. And we did a first sortie between Bishanpur to Sagang. Sagang is a village which is an island.
Okay.
Basically, there is a large sweetwater lake, name is Loktak Lake, and in the middle of the Loktak there is a Sagang island.
Okay.
And that island has 3,000 to 4,000 people, and that is not connected by a road or anything. So they have to drive through some boat or something. So this spot again, the most difficult part. So we chose it, and we delivered vaccines there, and people got vaccine, and they were very happy. Like they got vaccines through drone and everything.
Right.
And after that, we expanded it to many other districts like Churachandpur, Imphal West, Bishnupur. So many other districts we expanded. And on the request of state government, we delivered vaccines. We connected many PSCs, CSCs, sub-centers.
Sorry, sir, I have to stop you there. But when you say PSCs, CSCs, a lot of our viewers and audience may not know that. So
actually, when we say in health system, so we say in India there are 3 levels of health system. One is primary healthcare, and primary healthcare is initial point where we can get a basic kind of services. Second is secondary healthcare services, where we can have sub-district hospital, taluka level hospitals, where we can find out some specialists, some services are there, and the tertiary care hospital. So problem was not there with the tertiary care hospital.
Right.
Those are basically district hospital or medical colleges. But problem was there because that time was difficult, lockdown was there. And the time between two places, like if we are delivering vaccine from district headquarters to some PHC, so it takes 3 to 4 hours.
yes.
And every day we were not getting that much of supply. We can send like 100,000 or some large amount of vaccine. So every day we were getting something and we have to transport it in that way. So we started working on that. After completion of Manipur, we went to Nagaland, and in Nagaland we stationed ourselves in Mokokchung. That is a very beautiful district there.
Yeah.
And in Nagaland, only Dimapur is a place which is as a level of normal land. Otherwise, every rest of the state is a hilly state.
Is hilly.
So we went there and we faced so many difficulties, and we got to know like living there is very difficult. I can remember one incident when we met health secretary there, and he said, "Okay, Sumit, what is your target to go there?" I said, "Sir, our target is Mokokchung Twinsang." "Oh, you going Twinsang? I even been not there even once in last 2 years." So then I realized, okay, we are going somewhere which is really difficult.
Exactly.
We were not aware because we were just wanted to do something for the community.
Yeah.
As ICMR was supporting and leading that during the COVID time. And then we went like Mokokchung, we contacted their district health officer, district immunization officer, and they suggested us few list. They gave us list of sub-centers. Sub-centers is again a small unit under the PHCs, primary healthcare centers, and some primary healthcare centers which was really far away from the Mokokchung. And they said, okay, you have to deliver vaccines there. So there was one very interesting incident, like when we were in Mokokchung and we were trying to find out a route for Longsa. Longsa is a village which is just 26 kilometers away in a hilly area.
Okay.
And that time when we were trying to find out a way through the Google, which is more common.
Yeah.
So even Google was saying, okay, I cannot find out the route. So we have to deliver that place, even which the Google was not able to suggest us.
Right.
So we took help of local people. We did mapping, KML file.
Google, the original Google.
Yes, the local people we took help, because whenever we are doing vaccine delivery by drone, it is not like directly we will took a drone, we will send it. Before doing that, we need to develop some KML files, technical files, path, and everything.
Okay. When
And
you
then
say
only-
KML, so what does that mean?
So these are their language in their technical terms. There are files which define the routes of the drones.
Okay.
By that, these routes are, because the drones are blind, they cannot see. So every data you are putting inside the drones, it is form of data.
Right.
And they take coordinates and everything, and they go according to these KML files. So you have to feed everything in advance. So we have to generate the KML file and the path file. And there was one more thing, interesting thing, like in Nagaland, there are so many Assam rifles and so many paramilitary, military forces are there. So we have to coordinate with them also.
Correct.
Because they were sharing one thing, like if you will fly a drone without telling us, so we may shoot down.
We may shoot it down, absolutely.
Yes.
Yeah.
And this is very near to the Myanmar border, which is international border.
Yeah.
While we were there, so we have to coordinate with police administration, district collectors, army forces, paramilitary forces, with local coordination. And like their tribal population is mainly prevalent there, and they have very strong community sense, like they have community organizations. Even if you are entering into the village, it is not like you can go directly. So there are community people. First you have to contact them, first you have to take them into the trust. Okay, whatever you are doing in the favor of them. And then we delivered that Longsa, we were talking about Longsa, so we delivered that 26 kilometer distance, which was usually taking 3 hours. So it took just 10 minutes. And then we did it in 10 minutes. So the people were so happy, okay, usually it takes 3 hours. And you are delivering it 10 minutes.
10 minutes, yeah.
And even the health system people those who were village, they were very welcoming for us, and they were very happy, okay, you did it in 10 minutes. But like we were thinking, it was impossible for them.
Absolutely.
And then we were given even more difficult task, because I'm talking about 2021.
Right.
And today is 2024. So I'm talking 4 years ago, when even the drone technology was not that advanced. So they asked us to deliver vaccine to a Twinsang. Twinsang is a different district headquarter. Okay. And it is just adjacent to the Myanmar border.
And is the terrain as
more difficult?
Oh, okay.
More difficult.
All right.
And basically.
And also not discoverable on Google?
No, it was discoverable because it was a district headquarter.
Okay.
But road was really difficult. Like you can imagine, like if you are in Delhi or NCR region, if you are to travel 80 kilometers, it will take hardly 1.5 hours or so.
So I'm
90
from
minutes.
Mumbai.
Mumbai, so it will
And
take
I mean, I can't really say much, but I guess even mine is a very privileged outlook
yes.
because we have fairly all right roads
Yes.
in
So
both Mumbai or
now
Delhi.
you have C-Link and so many good things.
Exactly.
So it is more less, it takes less time. But there, because of difficult terrain and season and the landslides, so many things were there. So it takes 8 to 10 hours to reach Mokokchung to Twinsang.
Yeah.
And they said, okay, you go. So we did mapping and everything.
Yeah.
And they asked us to give us some big bag of 3,500 medications and units of the things.
Okay.
It was having medications, that was having some syringes, vaccines, so many things. And it was a big
So you
bag.
also need to take the responsibility of it being
Yes,
packed in a
yes.
way that's
It is not like just you can put everything. You have to
Always,
maintain
yeah.
the temperature.
yeah. Yeah.
क्योंकि you cannot miss that part जो हम कहते हैं cold chain maintenance. You have to
Correct.
maintain every vaccine in 2 to 8 degree. And you have to ensure like temperature जितना हम चाहते हैं उतना ही है. And it is not exceeding beyond the 8 degree or it's going
Right.
not below the
Right.
2 because all our live vaccines what we were transferring, so many. And so we did it and we transported that whatever consignment they gave us to transport. So from Mokokchung to Twinsang just in 30 minutes. And it was just
Wow.
like kind of
Wow.
wow. Sir,
Yeah.
you can transfer things in just 30 minutes.
Yeah.
Whenever there is a need of blood, because there is no blood bank
Correct.
in the Twinsang. So they said, okay, sir, sometime we need a blood, sometime we need emergency medication,
Yeah.
sometime many things. And it takes at least 6 to 8 hours.
Yeah.
Even you are going fast.
Yeah.
So you did it in 30 minutes. And here it was the longest flight that time,
Yeah.
40 kilometer. So air distance was 40 kilometer, road distance was 83 kilometer. And we did it in 28 minutes or 30 minutes. So it was the longest flight that time. Be so happy. Like then we did a
Yeah.
lot of deliveries there.
Yeah.
And in all, we delivered more than 20,000 vaccine doses there. And it's really helped the people of Manipur and Nagaland, and we were able to make a impact on that. So this was the end of, you can say, first phase
Right.
of. So we came back to the Delhi and we were settled down. Okay, this is done. This is how iDrone was started
Right.
initially.
So if I know that, you just mentioned about Dr. Bhargav telling you that you need to start with the toughest of the locations. But I'm curious to know, how are the geographies otherwise identified for the deployment of iDrone program? What would you say are the factors that you would consider? Because it now appears that sky is the limit, quite literally.
So you said sky is the limit.
Yeah.
So same. So considering that thing, so when we came back here and they said, okay, Sumit, so this is done. We said, okay, sir, it is done. And it was team of 4 or 5 people. Sir said, okay, although you have given name as iDrone, drone response and outreach for Northeast,
Yeah.
but you should not limit it to the Northeast. So he said, in North side, there are Himalayas.
Yeah.
So you should think of that. So we were again afraid, okay, what is like sir wants to say to us? Sir said there is place Lahaul and Spiti, so you should think of that. And then we explored, it is 11,000 feet. It's always in minus. So sir
Absolutely.
said, okay, you have to fly there. So this is your next task. So he said, okay, you have to fly in Lahaul and Spiti. So we took again this as a challenge. Air is very thin in Lahaul and Spiti and temperature is minus 10, 15.
Yeah.
And in these situations, battery doesn't work well. And drones need more thrust to fly. Even when we went there, but it took even like more than 10 days to acclimatize ourselves and then setting up the drone in the conditions where it can work in their situation. And one interesting thing happened there, like we thought we would be able to deliver medications to the PHCs, that is primary healthcare centers and sub-centers, and also to the secondary care hospitals, that is a sub-district hospital. And we thought, okay, we will take medications and we will deliver to these places. This is what thing we did it in Manipur and Nagaland. And also this time we did all these things, but also we conducted a qualitative research.
Okay.
And we actually wanted to understand what are the challenges which anyone can face if he is flying or trying to deliver medication and things at that level. we thought, okay, let's do it. So we went there and we realized, okay, there is no use of a flying drone there because they store medications for 6 months because they are cut off by the mainland
Right.
because of snowfall.
Correct.
And 4 or 5 months they have heavy snowfall, don't have any connectivity. So then we realized, okay, then there is specifically no use for drone flying there.
Yeah.
But then during our study, we realized they face problem in transporting sample to the PSCs to the higher centers. Because suppose if someone is there who is having cough, but they are not able to transport their sample because there is no vehicle, there is no transport.
Right.
Roads are laden with the ice snowfall. We find out, okay, the drones can help in picking up these samples. And also in case of emergency like snake bite is there, scorpion bite is there. Sometimes they don't have things to store like there.
Right.
So they need these emergency medications from the higher center. So in this situation, this can be useful. Third scenario, what we see like till primary healthcare center, like road is there. But at the periphery level, when you go to the hilly terrains, you have to cross the river. It will look like, okay, it is just in front of me. And you will think, okay, I will reach there in 10 minutes.
Yeah.
But actually it takes 4 or 5 hours. And there are places are so small, like where like 20 to 30 people just stay. So you cannot set up everywhere the healthcare facility, lab and everything.
Correct.
So you have to provide services there as and when need based. Again, then we realize, okay, if you want to deliver medication at that part or you want to pick up something from there as a sample.
Yeah.
So this could be a great learning. So this was the great learning of us that they don't need medical services as a drone for the transportation, but they need as a reversal mechanism. They need for sample pickup, emergency medications to outreach the peripheral activities. So this is what they did
then
there.
as a follow-up to that, what would you say? Have there been any instances where drones have been unsuccessful or would you say impractical in any kind of situations?
Yes, there are situations like drone, is even the flights are very sensitive to weather.
Yeah.
But for flight, we have air traffic control, so many things, data, which is supported for the flight and everything. But currently, we don't have that advanced system for the drone. Whenever there is weather is bad, windy air is like windy, raining.
Yeah.
So we cannot fly in that situations.
Yeah.
So this is one thing. So that is the most important limitation of this technology. And in some case, so always we were having some backup plan, although we were transporting it through the drone.
Correct.
But we were having some backup plan because again, it is just a flying machine.
And what would that backup plan be?
We were keeping ready our vehicles. If we were not able to transport the things to the destination.
Then do that 8 to 10 hour journey.
Yes.
Yeah.
So we were also informing all the emergency services like fire brigade here, medical doctors and everywhere, because if something happens, if drones fall down or something, because again it is a machine, they fall down, so it may damage something, so that we were taking into the consideration.
So I particularly would want to know what is the kind of feedback that you received. You spoke about all of these success stories and I think that's absolutely remarkable, but what is the kind of feedback you got from patients, from the community members? Because also I'm aware of how it must have been so hard to navigate that, right? You're getting into another state, another terrain with this contraption that nobody knows. It's in the middle of the lockdown. Anyway, people are, very tense, not trusting easily. So I'm curious to know about that. What was the feedback like?
That first thing, like the feedback will come with the later part.
Right.
First, we have to build the trust with the community.
Yes.
Because as I heard Shadi Wala drone, they also, because being a peripheral state, they were aware just drone are used for the bombing, war weapon and everything.
Yeah.
So they were afraid. Initially, they were afraid in Nagaland and Manipur. Okay, we are coming with the drones.
Yeah.
So probably they thought we are something related to army, related to paramilitary forces, and we are going to something with the bomb and all everything.
Yeah.
But then we had a communication with them, and I feel community participation, what we say.
Yeah.
So community participation plays a very important role. We assigned few roles to them also. Okay, you do this arrangement, you are responsible for this. So once they become part of this process, what we are doing, and we had meeting with because at the rural system, we have Sarpanch, Pradhan, and the community representative. We had multiple meeting. Then after that, building a trust. So they were friend to us, and after they received actual lot of medications and vaccines, then they were very happy. They were like, it is life saving for us. And even they write us, they call us, and they inform us. So there are many instances where we got this kind of communication.
So now I'm going to come to a slightly the uncomfortable part of this. So what would you say are the potential ethical considerations? Because my limited knowledge of drones, which is why I'm asking you so many questions, is that there are also those potential ethical considerations that one needs to, of course, be wary of. And I think you listed them quite clearly, just talking about the community's fears around it.
Yes.
But what would you say there are?
Yes, there are both kind of challenges, or you can say ethical consideration, because whenever you are planning a path,
Right.
so we were trying to avoid the residential areas, although it is taking the longer path, because in something happens and mishappening goes like that. So it should not fall on the areas where people are living. So we are trying to avoid the residential areas.
Right.
One instance also happened to us when we were in Manipur, in Vishnupur district. You know, like for each, in Manipur, there are multiple army and the paramilitary forces setups are there, and many times you are not aware, general public is not aware. We were trying to flying the drone, we were doing the calibration of drone. Somehow we were near to some army accommodation, and we were not aware, and we were flying drone and it settled down, and somehow, like, I don't know from where, people with the gun and that came out, and they surrounded us with the guns and everything, and jeep. And they thought we are some extremists, and we are doing something, we are trying to do something bad with the state. So they detained us, our drones and everything. Why I am telling, but that time we were having all the approvals from Ministry of Home Affairs, clearance from the collector, we were having support letter, we were having our IDs, although these are not very important parts seems. But then we realized, okay, these are documents which are very important, because then they took us to this was the 5 Maratha Light Infantry, and they took us to their center, and then they had some discussion with us, and then we realized, okay, so we have to inform military bases. They don't have time to do action, so they will take action. So same thing, we were informed in Nagaland, you have to inform the Assam Rifles, so we informed them. So these are few considerations. When we were planning for studies, we took ethical consideration. We abide with the regulatory norms, whatever India have.
Right.
When we started it, there was no drone rules, but now we have drone rules 2020.
What are some of them?
These are like at what level you can fly. So we say it's above the ground level, AGL, above the ground level. So it should not be more than 400 fits or 120 meters.
All right.
And it is also for green zone. So now they have divided country into the 3 zones. Green zone, red zone, and the yellow zone.
All right.
So in green zone, you can fly up to 400 meter and you don't need any specific permissions. But if you are flying in yellow zone, so the limitation is like half, 200 fits. And you need to inform, or you need to take some advance approval prior to the local administration and Ministry of Civil Aviation. And in red zone, you cannot fly. These are some regulations, and which kind of drone, because there are different categories of drone, small, nano, micro. So you can fly a small category drone, which should not have weight more than 25 kilometers with the payload. So these are regulations, you have to follow that, otherwise you will be in trouble. So you have to follow ethical consideration, that's regulatory consideration, and the technical. It is not like anyone can fly drone, even though I am working in drone, but I am not authorized to fly a drone unless I have a flying license. So that is by the government of India, Ministry of Civil Aviation. So they are providing license to fly a drone. If you have license, then only you can fly a drone.
And what would be the considerations, ethical considerations in terms of the supply? Are there any considerations there as well?
Yes. So actually, there are in medical supplies, we are limited to the healthcare system. There are so many things, like if you are just transporting a medications, which is not temperature sensitive, so you don't need to keep it into the very temperature controlled areas, so it is fine. But if you are transporting vaccines, so you have to transport it to the specific temperature. Otherwise, these vaccines will be not usable, or maybe they can cause side effects to it. So this become very important. Like we did blood transportation, where we did a study in NCR region, and Noida, Delhi were the centers, and we transported bloods and blood product. Now problem with the blood is that blood is very sensitive material, and it can hemolyzed, right? And it can cause a reaction. So you have to set up drones, vibrations, temperature, all things together. It should not harm the viability of blood.
Right.
So this is very important ethical consideration, because this blood is going to transfuse to somebody who is in trauma, who is in delivery or something. So you have to take care of everything. So these are few important ethical considerations that you have to consider.
Are you optimistic about the trajectory of drone technology in healthcare delivery?
Yes.
And I know that I'm supposed to ask you just the one thing that you're looking forward to, but I'm sure there are more than 5 at least.
Yes. So again, like what we did in Manipur, Nagaland, then in Lahore Spiti, and then we did the blood. But as you said, like why I am more optimistic towards the drone. So here, what we have seen till now, what we have listened till now, it was about the difficult terrain. It was about the high altitude, hilly areas. Right. Okay, this gives us an image like, okay, then this will be useful for the difficult terrain only. What's about our India's most of the terrain is flat terrain, and we don't have that much of difficulties. Okay, then don't we have any use? No. Then what we did recently in Karnataka, there is a KMC Manipal hospital, and it is surrounded by many small hospitals, which are those not equipped well with where we can take advanced surgeries. And just tell you a technical part, whenever you are having a surgery and the patient is having some mass or tumor or something, so we do suspect, okay, this may be case of cancer or non-cancerous. If it is a case of cancer, so then we have to resect that area. We have to excise that and we have to close the surgery. If it is benign, means not malignant, then you can close the surgeries and it will be settled down. What was happening at that place, at the secondary care hospitals, there was no facility where you can have a surgery, but you cannot make a diagnosis whether it is malignant or not malignant.
Right.
So what was happening? So whenever they were having surgeries, they were taking the tissue out and they were closing down the surgery. They were sending that tissue to the higher hospitals. Then hospital was reporting, okay, this is a cancer or not cancer. And then they were doing the second surgery and then they were completing the operation. So what was happening? The cost was involved, time was involved. And when you are opening a wound for 2 times, so there are chances of infections and many things.
Yes.
Last 3-4 months ago, what we did, the surgery was happening.
Okay.
And we did all the setup, we took all the approvals in advance, and we transported that oncopathological sample during the surgery itself. They opened the wound and everything, and they transported that tissue to the higher hospital. And then they did histopathology, kind of they give some idea, okay, this is benign or not malignant. And itself in the surgery, in the single
within
surgery,
that time frame.
So usually it takes 2 to 3 hours to reach there, but by the drone we were able to reach in 20 minutes.
Wow.
In 30 minutes we were having reports. They make a frozen section. After that they give a histopathological diagnosis, and they were able to complete surgery in the one go. So you can understand, like, this is not only for difficult terrain, but the smaller hospital which does not have that facility.
Correct.
That will make them compatible to or competent to that kind of advanced surgeries.
Absolutely. But sir, what is the availability of drones? As in, you're talking about all of these possibilities, which are so great, but I wonder whether all of the states or all of the far-flung areas actually know that this is a possibility, that there is this kind of service that is available.
Availability of drone, definitely ICMR doesn't own any drone. Whatever we are taking, all are indigenous drone. One good thing.
Right.
We are not hiring any foreign or any advanced countries services for transportation of drones. So drones are available.
Right.
Although whatever we are doing is different types of activities, we are trying to develop new use case scenarios, and we are explaining how you can do it and what is possible with the drones. So as you said, like whatever we did as a research agency, as a policy support making agency, we are doing this. But recently we have done one study where we are involved with the program, because all these activities were standalone activities. Once we went there, we started. Once we came back, it stopped. So it was just making a model.
Right.
But now we are starting one more activity in future, where we are doing collaboration with the state TV department, and we are involving this transportation of samples in the TV program.
Okay.
to achieve our national TB elimination
Wow.
agenda, what is there. So we are making a program where drones are being used to transport the sample to the higher centers.
Okay.
So
Nice.
we are also trying to do that.
We've spoken about everything to do with the future. So before I let you go, one single piece of advice that you would like to give young innovators, researchers interested in the field of biomedical research.
So I feel like this is not end of it. We have we have not achieved everything.
Yeah.
But still we are focusing towards when we would be able to transport a organ, live organ like heart or liver or some kidney through the drone. Those who are coming as innovators or technology persons, they can add more features to the drone. I feel in the future, the drone would be the future of the transportation, whatever we will do. So I hope it will be done.
All right, sir. Thank you so much. This episode was very, very interesting. I don't think I clued out even once. I was completely wrapped and I just loved all the stories, and more power to you and congratulations on all of these successes in the toughest of terrains. That brings us to the end of this exciting episode, and we really hope that you enjoyed our journey into the future of healthcare delivery through drone technology. A big thank you to Dr. Sumit Aggarwal for sharing his insights and experiences with us. If you found today's discussion intriguing, be sure to like, subscribe, and stay tuned for more episodes of ICMR Radio, Unpacking Health Research. Also, remember to follow ICMR on social media and be very sure to share all of these episodes with your friend family. Until next time, I'm Sanjana Chauhan signing off. Thank you. Goodbye.